With Texas and many other states beginning their process of reopening after the mass closures caused by the COVID-19 pandemic, injury and violence professionals are thinking about what our new normal will be as our communities, partners, and health systems adjust to the new environment. Let's hear from Ann Contreras from the JPS Health Network, Denise Geleistsmann from Austin Public Health, and Karen Beard from Driscoll Children's Hospital, how they perceive what this new normal will look like for the injury and violence prevention professional.
Hi, Denise, and hi, Karen. I hope you guys are doing well. Our topic today is talking about what is our new normal going to look like, which I hope at the end we come to a general conclusion. But what I've learned, for me, what I've learned during this time of isolation is while I thought I had a lot of things under my control, I've learned that I don't have much under my control. And initially that's caused quite a bit of anxiety for me. I have moved into a different phase. I think I was talking to Denise earlier and telling her I've moved into a more a phase of contemplation, of thinking about what I would like for the future to look like, and thinking in almost a very hopeful sense in that, wow, we have an opportunity here to change the way we look at things, both personally and professionally, as we move forward in these really uncertain times. How are you guys doing?
I would tend to agree that I feel like this is an opportunity for us to learn how to maybe even do things better. There was some discussion before, and I can't remember if it was on one of these discussions, but just talking about how car seat events may look different and how doing them now virtually is causing us to think through how we're explaining things to parents. And you know how we've all been at a car seat event and the intention is really for the families to be doing it themselves, but we all kind of jump in and do it a little more ourselves. And then this is kind of forcing us to really expect families to pick up and do what we're wanting them to do. So, you know, there's some positives there. I'm having to really think through presentations I give. Is that all going to now be virtual and I'm not going to be doing anything face-to-face for a long period of time? And how to work through that, and how is it going to be as effective? But you know, the maybe the positive side of that is you could reach more people. That's an aspect of it.
I'm a planner, so it has caused me some anxiety because I cannot plan a week, a month, 6 months from now, you know, and I make notes, so this has talk about anxiety, and so much is out of our control, or let's be real, my control. So it's really changed. I just have to stop and breathe sometimes and think, okay, it can't be this way anymore. So now what are we doing? So just like inspections, like you mentioned, Denise, our virtual inspections are different than what I've seen other people do. But even if the world was to go back to normal tomorrow, I think there's things we've done that we will keep. You know, there have been people that struggle to get here for a car seat inspection. The way we're doing them, we can continue that indefinitely and meet people's needs better. You know, so it's a learning process.
I agree with you, Karen. It's definitely a learning. And what I found interesting is that I'm touching base either virtually or by email or phone call with people that I hadn't in a while. I'm almost forming a kind of a new community around me in trying to solidify relationships in a different way. And what I'm also seeing is that on the other end is that people are they seem to be more open and receptive. There's that need to connect. It feels stronger to me than it had in the past.
Yeah, people that have kind of just seemed, you know, yeah, I'm involved, I'll do this, have been like, how can I help? What can I do?
Yeah. I think the anxiety I'm having is just knowing that, you know, in injury prevention, one of the key touch points is like doctors and that was one of the areas that I was often working in, giving presentations and being really connected to hospitals and doctors and clinics. And now that is just off the radar for them. Injury prevention is not something that's that important. They're dealing with so many other things. And I get anxiety about that because I feel like we're missing so many opportunities that it was difficult even before COVID, but now with COVID, it's like that's the top of everybody's list. And nobody's thinking about drowning or firearms or, car seat safety and all those other things. That keeps me up at night sometimes.
See, ours is a little different. We worked from home for 5 weeks. We've been back at work, I guess, now 2 weeks. And part of it is because our doctors wanted us back,
Mm-hmm.
which we exist.
Right.
So it's in that respect, it's kind of been cool. We've been lucky.
Yeah. I think for me, I see like we have the Safe Sleep Coalition here, and we had really been moving forward with so many things, and I'd been actively involved, on a weekly basis with some of the doctors from a couple of hospitals and some people in clinics. And I haven't talked to any of those people in 5 weeks at this point.
Wow.
And so, and I know I haven't even, part of it is I haven't reached out myself because I just know that there's other things going on for them right now that is not the top of their list and probably not even halfway down their list.
Mm-hmm.
Yeah, I haven't had a whole lot of conversations with our physicians, and I've been at home, I think this is week 8 or 9. I haven't had a ton of conversations with them, but what has increased are my conversations with my community partners, our high-risk domestic violence team, our adult fatality review team. We seem to be able to, pick up the phone and call each other. And you call the hospital and tell them that this patient's coming so they don't have to wait and things like that. So I haven't had the interaction with our docs, and that's something that I need to think about, because while they are obviously really busy in doing the work that they're doing with our COVID patients, I need to think about maintaining some of those other relationships as well.
Yeah, we've been blessed. Like I said, we haven't had the COVID cases like y'all are from bigger areas and all that. So we just haven't had it as bad. However, we have the beaches. We just have to think outside the box, in everything we do.
Right. And your
Have
beach.
there been any examples?
Sorry.
I was going to say, do either of y'all have any examples of thinking outside the box where you were able to achieve something differently than you normally would?
The answer has been Zoom for me. I live on Zoom. Car seat inspections by Zoom, out in their vehicles with their phone, Zooming,
Yeah.
Yeah, the only thing, and I don't know if it was so much thinking outside the box, but so one of our hospitals here was receiving car seats and doing their car, when people are discharged from the hospital and they needed a car seat, they were going through Austin Travis County EMS, but right now they're completely on hold and being pulled, of course, to do everything. So that entire community outreach is just completely placed on hold. And we were able to, luckily, Austin Public Health, find some emergency funding to get some car seats for those hospitals so that they would have them there at the hospital for people that needed to be discharged. One of my arguments for it when I was asking for the funds was not just because this is important for families to have car seats for their safety, but we need those hospital beds to be free. We need people to be discharged. And so that was one area that I was happy we were able to help with and hopefully supply car seats for these hospitals for the next 3 months or so.
That's a really good way to look at it. Keeping the beds empty to take care of the patients that need to come in. And that, to me, that's really intentful. And when you frame it in that manner, I think people think a little bit differently.
Mm-hmm.
I don't know. Now I'm looking toward being more intentful in the things that I choose to do or that things I focus on. I know that this time has really helped me with that for sure.
Thanks for watching, and remember to subscribe.